the objective of this presentation is to share with you some analysis that we have conducted based on the adolescent study in Ukraine that we have been working on together for the last few years. Specifically, we looked at it from the lens of to what extent can life skills contribute to adolescent resilience, interpreting the findings within the context of COVID-19 pandemic. So just some kind of to set the context for this. This is all in the context of an extreme adversity that adolescents in Ukraine and around the world are experiencing. I don't need to repeat here for anyone. I think that this is one adversity that needs no introduction. But the important thing to note is that one way the adversity or the COVID-19 has been affecting adolescents is that it has been taking them away from their typical protective systems, with school being the most important protective systems, and it has also been impairing the functioning of family systems because of the socioeconomic consequences of the lockdowns. So we already have anecdotal and some initial evidence of, for instance, an increase in domestic violence and abuse as a result of COVID-19. We have some initial evidence regarding an increase in mental health symptoms. And in fact, resilience, I was just yesterday unmasked, and just a couple of days ago unmasked, and who is one of those of you who are involved in the resilience field probably know her as one of the leading experts of the resilience field. She, in a mailing group that I participate in, she sent through an article that she just published, which describes COVID-19 as a multi-system adversity, which is simultaneously affecting various aspects of physical, social, emotional, academic, and economic life. And in this regard, when you have an adversity, of course, part of protection is about building resilience, but in this context, if we have a multi-system adversity of the type that we rarely see in peacetime, we see such multi-system adversity situations in full-fledged wars, but in peacetime, this is unheard of. So in this regard, it's a fair question to ask, how can we nurture resilience in the context of this multi-system adversity in order to reduce the risk of negative developmental outcome during these difficult times? And of course, the concept of resilience is itself multidimensional, and we can talk about resilience at different levels. We can talk about the resilience of social systems and institutional systems. But in the context of this presentation, I will be focusing on how life skills can play a role in ensuring that a young person remains resilient amidst adversities, and specifically amidst COVID-19. Precisely understanding that given that contextual systems have been so much affected, and we really don't know in the course of things how they will continue being affected, building up the skills of adolescents so that they have coping capacity is particularly important. But which life skills are most relevant as sources of resilience? Now, of course, we do not yet have data that was specifically collected in relation to COVID-19. It is personally, I'm involved in some studies, for instance, in Libya, looking at individual and community adaptation in the context of COVID. And other colleagues are doing the same, but really we don't have data yet. We don't have data on resilience that is specific to COVID, but what we can do is that we can draw some initial conclusions from studies of resilience in adolescent populations experiencing other extreme adversities and transpose those results and say, okay, since we know that this is what contributes, for instance, to resilient mental health in adolescents, we can hypothesize that the same sources of the same capacities would contribute to resilience in this context as well. So in this case, of course, we have a sample of more than 7,500 conflict-exposed adolescents in eastern Ukraine who have simultaneously experienced other social and economic adversities. And we have measured all that. We have measured their adversity exposure. We have measured well-being. We have measured life skills, So that's actually that data set that we already have, and we collectively invested quite a lot to get it to get that data, is a very good candidate for reanalysis in order to draw some conclusions on resilience and then interpret those insights from the perspective of adapting in the times of COVID-19. So what was the conceptual and analytic framework for this analysis? First of all, we used we focused on our metrics of adversity, which in the previous waves, this is from the data from late 2019, and the adversities that we had measured were family violence and abuse, conflict exposure, and associated hardship. Adversities lead to negative developmental outcomes, of course, and they specifically are expected to impair mental health and sense of well-being, but also readiness for positive and constructive citizenship. These are two different outcomes, and we saw in Ukraine that some adolescents kind of struggle with the one, but other adolescents struggle with the other. It's not one and the same. And activation of life skills are processes that enable resilience. So what we did is that we first looked at how adversities impact outcomes. We then saw which adolescents are doing better than expected in terms of developmental outcomes, given their level of adversity. And then we saw what life skills those adolescents possess, which have been supporting them to display resilience in difficult times. So which skills did we measure? Now, those of you who are more familiar with the Ukraine Adolescent Study are, just a second, please, just a second. Yeah. So those of you who are more familiar with the Ukraine Adolescent Study are aware of the skills we've been measuring. But if I was to kind of quickly summarize and just put them in 3 columns in a way that is compatible with the transferable skills framework of UNICEF, which is separating in social, emotional, and cognitive skills. We have measured 8 different social skills. So we measured expressive and receptive communication, speaking out, and being a good listener, which are 2 different skills. We measured cooperation. We measured negotiation skills when you are trying to mediate a disagreement, leadership skills when you're trying to lead your team of peers through a challenge, respect for diversity, kindness, and also participation. In terms of emotional skills, we measured self-management, distress tolerance. So that's remaining unperturbed and remaining hopeful in when things are not going well. That's kind of the definition of distress tolerance. Mindfulness is staying focused in the here and now, that is. And gratitude, which is an emotional skills, because we put it under the emotional skills because gratitude is what enables you to keep having positive emotions by focusing on the good things in your life, even when things are not going well. And then cognitive skills that we measured include intellectual humility, which is acknowledging what you don't know, yeah, and accepting that others, that there are experts, as it were. Growth mindset, which is of being always willing to learn more and accepting that you are a work in progress. Creativity, critical thinking, future orientation, which means being able to focus, to imagine your future self and organize your life so that you achieve your aspirations. Decision-making skills, course correction skills when you realize that your path has not been effective and you need to course correct. And of course, problem-solving skills when you need to troubleshoot an obstacle that has appeared in your way. So we have metrics for each of those skills. Each of them was measured by 4 questionnaire items in the Ukraine Adolescent Study. And we have scores, let's say scores from 0 to 10 for each of those skills. And those have figured in several of our reports, of course. And so how do you calculate scores for resilience? The way we do this is that we define resilience as doing better than expected given your level of adversity. And so if you see this diagram, on the x-axis you have exposure to adversity, and on the y-axis you have level of adaptation. And what you would normally expect on average is that as adversity increases, so as conflict exposure, for instance, increases, as family as a hostile or an abusive family environment increases, you would normally expect adaptation to start falling off. Yeah, so you expect to see worse mental health, you expect to see less readiness for positive citizenship, etc. So this dotted line represents the average, our average expectations of how we expect an adolescent to be doing in the face of adversity. We expect most adolescents to do well when they're not exposed to adversity, and we start expecting more adolescents to start struggling as the adversities pile up. Now, that's just impact analysis though, right? That's not resilience. Resilience is when we start looking for the exceptions. So each of those stars in the diagram is one adolescent, just this to help you to conceptually understand resilience here. So if an adolescent is exposed to quite extreme adversity, but is actually doing better than you would expect on average, that difference between how well the adolescent is doing and what you would expect on average, given that level of adversity, is that adolescent's resilience score. Yeah. So it's not just how well you're doing, it's how well you are doing given how much you're going through. Yeah? And that's the definition of resilience. And what we've done in the Ukraine Adolescent Studies, we actually managed to create a metric, a score from 0 to 10, if you like, on how resilient an adolescent is. And we've actually developed two different resilience statistics. One of them we call resilient mental health, which is maintaining emotional well-being and a sense of purpose in daily life despite exposure to adversities. And the second is resilient positive citizenship, which means despite exposure to adversities, you are still maintaining positive connections with the wider community and the readiness to play a constructive role. So those are the outcomes that we want to nurture here. We want to nurture these two resiliencies. And by the way, we have found that these are two very different things in Ukraine. I don't know how different they are in other countries. Most of our knowledge in this regard is from Ukraine. But what we're seeing in Ukraine is that you can be one but not the other. Some adolescents are displaying resilient mental health, and other adolescents are displaying resilient positive citizenship, and some are displaying both. Yeah, but but the two seem to be varying quite independently from each other. So we need to think separately how we cultivate the one and the other. And of course, both are relevant in the context of COVID, because you may want to ask regarding resilient mental health, you may want to ask, to what extent are adolescents still coping emotionally and psychologically in the context of COVID and not falling into anxiety and depression despite everything? But you may also want to ask, one moment. Yes, and so you may also want to ask to what extent adolescents still remain positively engaged in their community and not lose the heart to help out and play their role in supporting their families, supporting their peers, contributing to community adaptation in the context of this adversity. So as a comment that I saw just now as well in the chat, both of these resiliences are very important. So what we have found in our analysis, we have, first of all, what we have done is that we have run predictive models of life skills predicting resilience. And what we have found is that for both outcomes, for resilient mental health and for resilient positive citizenship, a significant proportion in the variance of those outcomes is explained by life skills. So adolescents that have more fully developed life skills are more likely to develop positive outcomes amidst adversity, including in the mental health domain, as well as in their role as positive members of their community. And we actually found that more than 20% of the variability in these outcomes is linked with life skills, which is a very important component of variability, that it's something that we can directly affect if we nurture life skills. But of course, and now this is the most important, probably, this is the densest, but probably the most important slide in this presentation. By the way, I will be sharing the PowerPoint afterwards with everyone, so don't worry about taking notes or anything, because you'll be able to review this presentation in your own time. So what we have found is that while life skills are an important predictor of the overall variation in resilience, not all life skills are equally important as predictors of resilience. And specifically what we found, so what you see here, these are, for those of you who are more statistically inclined, these numbers here are regression coefficients, yeah? And the darkest, we are using a color code to explain, to give a sense of how important something is, how important something is as a predictor of resilient mental health. So distress tolerance at 0.26 is the strongest predictor of resilient mental health, and gratitude at 0.17 is the second most important. And then as you go down to 0 or negative, that means that those don't really play a specific role in resilient mental health. Negative, you shouldn't think of the negative ones as being necessarily a problem in mental health. It just means that when you develop those skills in an unbalanced way, that may actually impair your mental health in times of adversity. So for instance, you see that receptive communication is at minus 0.16. That means that when all else is equal, if you over cultivate your listening in a time of adversity, you will start listening and absorbing to a lot of distressing information. And that's why receptive communication may actually make you more fragile in times of adversity. That doesn't mean that receptive communication is a bad thing, but it means that it could become a bad thing if it's cultivated on its own in an unbalanced way. So that's the way to interpret what are the few negative numbers that you see here. But what I'm focusing here in my analysis are the positive numbers. And what we and what is really interesting to note is that if you look at the results for resilient mental health and resilient positive citizenship, we have very different sets of skills predicting the two outcomes. There's actually almost no overlap in the skills that are relevant for the two outcomes. And that actually probably explains why those outcomes are have different scores in Eastern Ukraine. So for instance, distress tolerance is really important for mental health, but not for citizenship. Intellectual humility and the growth mindset are really important for positive citizenship and also critical thinking, but not for mental health. So if we're looking to nurture both outcomes, resilient mental health and resilient positive citizenship, we need to focus, we need to put together, we need to think what needs to be added in our skills curriculum for each outcome, and then blend the two together into a more holistic package, as it were. So to summarize what we are seeing in terms of needed skills for each of the two outcomes, for resilient mental health, the most important skills to nurture are distress tolerance, gratitude, cooperation, expressive communication, and self-management. I will talk about them in the context of COVID further in a minute, but you can see that we have some emotional skills here and some social skills. So we have distress tolerance, gratitude, and self-management, which will classify under the emotional skills. And then we have cooperation and expressive communication, that's speaking out, yeah? Not listening so much, but speaking out, speaking your mind. That's the one that really matters for mental health. For resilient positive citizenship, we have several cognitive skills, plus a couple of social skills, but different social skills. So we have intellectual humility, growth mindset, and critical thinking, which are cognitive skills. They have to do with learning, but also filtering information. But then we also have receptive communication, being a good listener in this case, and respect for diversity as relevant social skills. So you see that this gives us an evidence base, is because the problem that everyone has with skills is that it's such a wide menu of possibilities, and so many different taxonomies of skills that one can focus on, that it very often it feels like shooting in the dark when you try to put together a skills curriculum. But this approach can help us to decide what skills to focus on, depending on which outcome is most important in any given for any given population. And of course, if we want both outcomes, which I think I understand that UNICEF is actually trying to balance these two outcomes in its in its thinking of adolescence. Then you would need to bring in skills that are relevant to each, and as you can see, that they're very different skills. So, just a brief kind of summary point before interpreting in the context of COVID. So, we are seeing that life skills are helping adolescents maintain higher levels of mental health and positive citizenship in the face of adversity. And in this regard, life skills could be a potential asset to cope with adversities associated with COVID-19, which Anne Masten has described as a multi-system adversity. It's the biggest adversity probably that adolescents have experienced. Skills for resilient mental health can be cultivated to reduce the risk that adolescents exposed to consequences of COVID-19 might develop mental health problems, while skills for resilient positive citizenship can be cultivated to ensure that adolescents exposed to COVID-19 will remain positively engaged in their communities and resist the urge towards polarization and hostility of outgroups or of public authorities, which is something that we are seeing around the world, unfortunately. We're seeing a lot of insular responding to COVID-19 and social cohesion fragmenting. And that's what we can avoid by cultivating skills for resilient positive citizenship. So more specifically, how can we interpret these skills? And I will briefly talk about this, but then I will let you all to reflect on them. We can discuss further, and of course you can absorb it in your own time as well. But what we have done at this point is that we took each of those skills that was evidenced to be linked to resilience, and then we are discussing it in the context of COVID. So for instance, distress tolerance, what would that look like if we programmatically focus on distress tolerance in the context of COVID? What we would do is that we would be assisting adolescents to differentiate what is and what is not within their control. So what you can control, for instance, is your own social distancing and whether you're wearing a mask and washing your hands and whether you're supporting your family and peers. And what you cannot control is the epidemiological statistics in the country or around the world. You cannot control whether there will be lockdowns and when the lockdowns will end. So by assisting them to differentiate the one from the other and focusing their efforts on the former and accepting the latter, that is known to increase, that those are skills that contribute to distress tolerance. The other also encouraging awareness and acceptance of both positive and negative emotions linked to COVID-19, linked to the current situation. So positive emotions because of friends, negative emotions because of health concerns, and accepting both, cultivating hope that the pandemic and related lockdowns, etc., will eventually pass. All of that will contribute to distress tolerance. Gratitude can be cultivated by encouraging gratitude towards doctors, nurses, scientists, local authorities, etc., who are working to counter the pandemic. Cooperation skills can be in the context of providing encouragement, opportunities, and support for teamwork and collective action at the family, school, and community level to deal with the consequences of COVID. Expressive communication, which is really important for mental health resilience, is creating the enabling environment where adolescents can freely express their fears and concerns related to COVID and learn how to be better at seeking support when they need it and contributing their ideas and suggestions on how daily challenges can be addressed. And self-management, of course, is about ensuring that adolescents are discovering positive ways to structure their daily life amidst the pandemic while avoiding impulsive and risky behaviors. And when it comes to skills for resilient positive citizenship, those are starting from, again, going down the list of what was found to be empirically significant. Intellectual humility can be cultivating by highlighting and showcasing the expertise of scientists and health professionals so that adolescents feel that they have much to learn by listening to their guidance on how to mitigate the emergency. Respecting diversity can be contextualizing by encouraging acceptance of the diverse ways in which individuals may be coping with the pandemic, some by focusing on health, others on livelihoods, others on relationships or connecting with nature. This is actually really important in households because we're seeing that happening a lot in households in the context of COVID. The typical father concern is not the typical mother concern, is not the typical adolescent concern, but everyone is trying to cope with the pandemic. So nurturing this respect for diversity can really help a lot to connect the different members of a family or of a community and helping them understand that each approach contributes a unique and valuable perspective on mitigating the emergency. Growth mindset could be about framing the COVID-19 as an opportunity to acquire new knowledge and skills, to strengthen relationships, and more generally to grow through the challenging experience. Receptive communication can be about encouraging adolescents to be receptive towards family members, peers, or others in the community so that they can develop a wider perspective on current challenges and identify ways in which they can help. And finally, critical thinking should be about supporting adolescents to separate facts from wishes and unsubstantiated opinions when it comes to COVID-19. So having the critical literacy to evaluate the credibility of different sources based on their scientific standing and their official status. So that's that's one way to start thinking about how these skills that we have empirically found to be linked to resilience, how they can be integrated into COVID responsiveness. Of course, you may have other ideas as well. I mean, this is just our kind of take on how they can be linked to COVID. What we are contributing empirically is that we're contributing our evidence that these skills in the context of Ukraine are relevant for resilience. Now, how they are leveraged for COVID, these are some first ideas, and you may have your own ideas as well. Now, finally, some ideas on next step. This is actually a direct response to what Bogdan said at the beginning, that what can we do with this? So I will share some ideas for colleagues to consider. These are not necessarily things that SEED could or should do, but I think these are interesting ideas for follow-up. It may be something that SEED can help with, but these are more generally ideas for follow-up from these results that UNICEF colleagues may wish to consider in one way or the other, either through their work with the Ministry of Education or with NGO partners or internally. So these are four suggestions of where this could go. One of them, the easiest one probably, would be to compile some visually attractive skill cards to be disseminated through social media and through mailing lists. One example that I have some examples here, and maybe in the discussion, in our discussion, maybe I can actually click on them and we can have a look at them together. But I saw an interesting application of this approach from the Harvard University Health Services, where they put out on social media 15 tips on managing fears and anxieties around COVID-19, and each of they are very much skills related, though they're not using the skills terminology. And each of the tips is its own infographic, and it's separately disseminated through social media so that it can become, let's say, viral on its own right, as it were. So that's one approach. Another approach is brief psychoeducational videos on skills for resilience that can also be disseminated through social media and mailing lists. One example is a World Health Organization video. I think it was done by the Southeast Asia office of WHO, but it's better than anything that I've seen out of Geneva in this regard. And that video is about staying mentally healthy during COVID-19. It's only 1 minute, and it actually touches on several skills for mental health, but not just for mental health. I would say it's skills for mental health and for positive citizenship. And you can find it on the YouTube link that I'm sharing here. This short 1 minute format, of course, is excellent for direct beneficiaries. So this is the kind of length of video that we would want if we want to target adolescents directly, because anything longer than that will not be watched and shared. We have created our own video on life skills for resilience amidst COVID, not related directly to this analysis. This was an initiative of my lab at the university with SEED and other colleagues right at the beginning of the pandemic. So this was a 10-minute video now that longer format is more suitable for service providers such as psychologists and social workers. So that longer videos I would recommend if we want to be training the trainers. That's where those longer videos can really play a role, because in this longer video, we are providing guidance on how exactly to conceptualize each skill and how exactly to build each skill. So such longer videos can be considered for rapid dissemination across across volunteer networks or across educators, etc. Another approach, now we go to the more those two are the easy ones, the skill cards and videos. More elaborate responses to this could be First of all, liaising with the Ministry of Education or NGO partners or both to develop resilience-oriented skills curricula for implementation during the coming academic year. And of course, as colleagues know, there are usually two different channels through which this can be done when we're working for skills through education. One of them is by integrating skills in the main academic program. So in different classes, from math to science to history, to build in some of those skills. That's one way of doing it. And of course, the other way of doing it is to develop standalone resilience training groups organized around skills that have been shown to contribute to resilience. One well-known example is the University of Pennsylvania Resilience Program. And I provided, of course, I wouldn't recommend that one specifically because first of all, it's super expensive to get trained in that, and it's highly commercialized. And secondly, it's not exactly the skills that we have found here to be relevant to resilience in Ukraine today. But it may help you to understand what a group-based resilience intervention for youth could look like. And finally, the final idea is to conduct focused research on skills for resilience, specifically in the aftermath of COVID-19, because of course the analysis that I presented to you here is a reanalysis of data that was collected not specifically for COVID, but of course it's still relevant, but we would know more and we would get a better signal if there is more specific research about resilience to COVID, like studies that we are now conducting, for instance, in Libya. Now, there, I would break that down into indirect and direct research possibilities. So an indirect research approach would be maybe a qualitative survey of service providers, psychologists and social workers and educators and others, to investigate skills which they believe have been contributing to adolescent resilience amidst COVID-19. So just having a kind of an interview questionnaire where teachers and psychologists are asked, think about some adolescents that you have been following that showed remarkable resilience during COVID, either in terms of their mental health or in terms of their civic engagement. What were the skills that you saw in them? Yeah, so that would be a way to approach this in a simple qualitative way. Then of course, there is direct research, which would be a quantitative survey of adolescents to establish empirical associations between specific skills and effective coping during the pandemic. This would look a lot like what we've been doing, of course, and it would. The difference would be that we would also be including COVID exposure amongst the adversities and consequences of COVID. So, to what extent has COVID affected your family in financially? To what extent has it affected your family socially, etc.? To what extent has it affected your community in different ways? And it would also possibly include skills that are more specific to the responding to COVID. So to what extent have you been engaging in social distancing or washing your hands, and then understanding how life skills or transferable skills have been contributing to all that. That's the kind of work that's the kind of research that would make sense at the level of adolescence. But so I'm just mapping out here what are the different possibilities both from in terms of direct outreach, that's the easy picking. So just using what is already the findings of this study to already do direct outreach through cards and videos, using some of this to design resilience-oriented life skills programs, and or conducting additional research. I think these are some of the directions in which this can go. So thank you for your attention.